Hello friends, my name is Dr. Saeed Kazmi. Welcome to my YouTube channel. Today we will be talking about how to approach communication stations in the MRCPCH Clinical Examination. So in this examination there are two communication stations, each of 9 minutes. You are given 4 minutes to read the scenario, which is usually revolving around some clinical condition or about a situation, and then you are given a task which actually revolves around your communication skills. You are usually given a task to talk to the parents about a condition, or talk to angry parents, or talk to a child how to use a particular device, so on and so forth. So some of the common type of stations that come these days in this clinical exam, they are number one, stations which actually revolve around giving information about some condition, procedure, disease or equipment. So that the scenario might be revolving around some chronic condition in which you have to tell the parents about what is the diagnosis and what would be the prognosis. It might also involve information about using some equipment, like for example how to use the EpiPen. Some of the stations, they revolve around like breaking bad news, so you have to talk to the parents and give them a news about diagnosis of maybe that might be a chronic condition or might be something bad like a cancer. Some of the stations might revolve around like talking about the treatment and management issues. So a child who's probably not complying with the treatment, so how to talk with them, talking about the issues and making some common agenda to take forward. Some of the stations might be about teaching your junior colleagues, and these are usually regarding ethical issues. Some of the stations might be like around conflict resolution or angry parents, like parents who are not angry with something and you have to talk to them, listen to their views and try to help them out. Some of the stations might be revolving around giving information to the parents about medical errors which have been made on the ward. Usually the parents will be very angry, so how to talk to them. And sometimes a few stations could be about supervision issues where you have to supervise your junior doctors. But by and large, most of the scenarios, they are either regarding information giving, they are either regarding breaking bad news, or about like conflict resolution or talking to angry parents. So again, as I said, there are two stations, communication station A and communication station B, and 9 minutes for this whole task that you have to do, and 4 minutes before that to read and try to make your plan what you have to do in the those 9 minutes. Many people freak out because this is something which is not given in the textbooks. This is something which you develop over a period of time, because you are working in a hospital. Everybody's got their own communication skills, and over a period of time they refine those things. Some people like who come from different backgrounds which are non-native, where English is not the first language, they might struggle because sometimes you have to use very simple words. I mean, in most of the stations, you don't have to use the medical jargon, because you have to explain to the parents in very simple words. So again, practice makes a man perfect, and the bottom line is that you have to practice these things a few times, and probably you would master them over a period of time. Now, the basic framework of approaching this communication scenario, there are a few principles that you need to understand, and you should remember it on your fingertips, because you have to do it in every station, irrespective whether that's information giving, that's talking about condition, whether that's talking about sort of an equipment, or that's talking about angry parents or supervision. So the first thing is you always introduce yourself. So whenever you go inside with a happy smile on your face, looking into their eyes, you will introduce yourself like, my name is Dr. ABC. I'm one of the pediatric doctors. I'm here to talk to you about like blah 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 blah. So you have to introduce yourself. Then when you sit down, making them comfortable that they are ready to talk, usually a theme that you should remember after introducing yourself, that if it's about like the station is about like information giving or about breaking some bad news, ask them what they already know, because I mean, you don't want to waste your time 9 minutes telling something which they already know. So you ask them if they know already something about that, and from whom. So it could be like, for example, I know your child is not well, or how is your child doing? Has somebody told you about him, like how he's doing? And if they say yes, then you ask them whether it was a nurse or a junior doctor or whosoever it was. So you try to get a view of what they already know, because you can take it onward from that point rather than like starting from the very basics and wasting your time. Sometimes the information can be very broad, and obviously it's not possible for you to cover all those things in those 9 minutes. So if you think that the information, the scope of information is very broad, there are two things that you could do. Like if they know something, you ask them what they would like to know. Is there any particular aspect that they are worried about and they want to know more about that? Or if not, they say, no, we don't know anything. Then if the scope is very broad, you just tell them that, see, this is going to be a lot of information, and I can understand it might be a bit difficult for you to comprehend this in this short period of time, but please don't worry. I will try to make it as simple as possible. And this is not the only time that we are going to discuss this thing. I understand you would be definitely having more questions at the end of this discussion, but please feel free to ask me more. Or if needed, we can arrange some more sessions, so I can come again, or my senior consultant can talk to you, or somebody else can talk to you, and so on and so forth. So at least you ensure them that this is not going to be the only session that you're going to have with them, and examiners want to know that you are actually addressing this aspect of the communication. So once you've done that, the other point which you need to know is, like, you have 9 minutes, you just like briefly tell what you're going to discuss in the first. Okay, so okay, fine. It's about like let's say equipment, how to use an EpiPen. So you tell me, okay, you tell them that, okay, well, fine, I'm going to tell you how to use this when the need arises. Okay, so in that 9 minutes we're going to talk about how to use this, what are the precautions to be used, what are the conditions in which it has to be used, and if there are any problems, how to address that. So like you just within like 15-30 seconds, you just tell what you're going to discuss, and then you start talking to them. That is the main crux of your talk. So there are a few things. When you are talking to them, look into their eyes, use your body language. So like, for example, lean forward, as that actually shows that you are interested. It's not like you are laying back, leg over the other leg, as if you are, like, if you don't care. Just slightly, you look into their eyes, you use your body language, use your hands to explain. Sometimes the information might involve a bit more complicated things. Like, for example, if there's a heart condition, so obviously when you are trying to explain something like a congenital heart disease, like a hole in the heart or something, you need to tell them a little bit about the normal heart as well. So it's better if you take a piece of paper and let's say a pen, and you draw and you say, okay, you see, this is the normal heart. It's got 4 chambers and the blood flows from this side to this side. And then, you try to explain that there can be a hole. There could be an abnormal connection between these 2 chambers, and that is what we call as a VSD. So you tell them, and as you go along, you check their understanding as well. It's not like you talk. They are not looking at your knowledge base. Basically, they are trying to see with your knowledge how much can you make them understand. So it's important that as you're going along, you ask them, are you with me? Do you understand? Do you get this? So you check their understanding as you go along. Finally, at the end of your talk, like in the last 2-3 minutes, you give them an opportunity to ask questions, and it could be in between as well. It's not like that you always say, okay, well, you can have ask questions at the end. You can say, if you don't feel like you're not understanding it, you just like stop in the middle, and I will be more than happy to answer your questions. So, and at the end, you also, okay, fine, have you got any questions? If there's about a procedure, something, you say, okay, fine, can you please like repeat what I've said to you? Okay, so just to make sure that they have understood. And then in final, let's say 30 seconds, 40 seconds, you just close it. So you say, okay, well, fine. So this concludes our talk for today. I can understand you've got some more questions. I can come back to you anytime, or my senior would talk to you about this when he comes for the round. Or you can give, okay, well, fine, this is some more information about this condition. I'm going to give you some leaflets. These are a few websites that you can go and visit. Or if you've got any concern or something, we are open 24/7. You can anytime, anything, you can just call us and you can bring your child back. So this is usually where you would conclude your communication scenario. So these are the few things that you need to apply in every station, irrespective of whatever the station was. So you introduce yourself, what they already know, what they want to know, if applicable, tell them what they're going to do in the next 8-9 minutes. Then start with very easy language. Use your body language, look in their eyes, try to explain to them in very simple words. Do not use like medical jargon, just simple things, and check their understanding as you go along. Ask them to if they've got any questions, and at the end conclude it, close it, and if applicable, give them some safety netting. So this is the basic framework. You just need to remember this, do a little bit of practice, and trust me, you will master that. That's not like rocket science. It can be done easily. Now let's move on and talk about this different types of stations. So one of the common stations that we get these days is like about information giving. So it's usually there is a scenario about something that so was diagnosed about with let's say with cystic fibro or something. Talk to the parents and give this information. So as I told you again, you have to enter the station, introduce yourself again, tell them you are the pediatric doctor. They said, then what do they already know? So again, as I told you earlier, you have asked them if somebody's already told them about the condition, like for example, if a nurse told them that this might be the thing that they are suspecting, or sometimes you ask them that have you heard about this term, or is there anybody in your family who suffers a similar condition? And then they would probably say yes or no. Yeah, my cousin or my niece has got this condition. It's okay, well, fine. So you might be familiar with something. Let me tell more about this thing, okay? So then tell them what you're going to tell them. So you say, okay, well, fine. I'm going to give you some information. Some of this might be a bit complicated, but I'll try my level best to make it as simple as possible. And please, if things are not getting clear, just stop me anywhere in between, okay? And I will explain. Okay? Also tell them that, okay, I've got this time for you. We will not be disturbed by anybody. So please feel free to ask any questions, things like that. Then you just tell them about the condition that, like, for example, your child is suffering from this condition. We did this test and it is showing, unfortunately, that he's suffering from this condition. And if needed, you can use diagrams to explain that. And as you go along, you try to make sure that they understand and they are with you. Then at the end, you'll give them an opportunity to ask questions. If you got any questions, like they may say, what would happen to my child? Would he die? Things like that. So then you have to give them, there might be some difficult questions. So usually it's not like you say, oh, yes or no. You just tell them, like, from evidence, it is seen that majority of these kids, they do very well with the passage of time. As we have got good treatment these days, he would be supervised, having supervised treatment. He would be having follow-ups, and these days with all these modern treatment, majority of them have live a very good quality life, things like that. And then at the end, you will close, as I said, like you will summarize. And if it is a complicated information, you tell them that, okay, I know this is going to be a bit too much of you, and you will be having more questions. So you just like read about this thing. I'm going to give you some leaflets and I'll get back to you. Or maybe my senior comes and he will talk to you further about this condition and he will explain it further, or things like that. So this is how you will conclude a station about information giving. So as I told you, most of the stations probably, if you look at different centers, at least 60-70% of these communication stations are regarding information about a disease or a condition. Then coming to breaking bad news, this is another common station where you have to break a bad news about a condition or a diagnosis which the parents don't know. Again, you will go through the same drills, introducing yourself, who you are. And in this particular station, it's also important that because you are breaking bad news, so you tell them if they want to have somebody with them, like if the mom is there, would you like to have your husband with you or your partner with you, so on and so forth. So, and then you tell that I'm here to with you to explain the condition that your child is suffering from, and this is how you would proceed. And then usually just telling them, okay, well, fine, my name is this and this, do you want to have anybody, and your child is suffering from this. No, you don't go like this. So you usually start with how your child is doing and what is their understanding of the child condition. Now, in most of these cases, because the child is going on with some ongoing issues which have now been diagnosed to be being caused by a particular condition, so they would tell you, yeah, well, I mean, he's doing like this and that, he's in the hospital and I think he's getting better or is not doing well. So you ask them and you say, okay, well, fine, do you have any idea, like the child has been having all these problems for a long period of time, what do you think he could be having, or has somebody told you what could be the possibilities? So just see if they know something about like that particular, if the fear is, they're thinking about a cancer or something and the diagnosis is that, then you can say, yeah, I mean, this is one of the possibilities that children who present with these can have this thing. And Then you go that, as you know, that this child was very unwell, and we are worried that probably he has this condition that you were also thinking of. And we are trying, everything that we can do for him. But despite doing all these things, either he's been diagnosed with this, or I think he is not doing well, and we need to move him to another hospital where there are better facilities for him, where he will be keeping intensive care, or where there's more expertise available to take care of them. So things like that. So you start with something that they already know, and from there, in chunks, you will bring them to the bad news. Okay, your child was not doing very well, and we were thinking that there were different possibilities. So we did a few tests, like we did a sort of a biopsy to see what's going inside, and unfortunately we've got the report that there is an abnormal growth. And then you say, do you know what is an abnormal growth? Okay, well, fine, let me tell you. So some of the cells, they start dividing abnormally, and they start spreading and eating up the normal cells, and this process is known as a cancerous growth. And then you stop. It's not like you talk, because obviously you've broken something, and it is a shock for the parents. It's easy. So you stop in between. They would say, okay, what did you say? You said, and then they might, like, some of the, because they are actor role player, they might start crying or weeping or pretend to. So you stop over there. You say, I can understand your condition. This must be a very hard time for you. Let me give you a tissue. So give them a tissue paper or something. Or you say, would you like to have a glass of water or something? So you just try to help in between. And when they say, okay, doctor, what we do now? Okay, so felt fine. This is this condition, but what I can say you that there is very good treatment, and because now we have got a diagnosis, we have got different treatment options. So we will try to arrange the best treatment for him. Things are like that. You need to trust after the breaking. So you try to give them the options, and you move from there. So the bottom line is that you go in chunks. You start from what they know, and then you break the bad news in chunks. And when you've broken it, you just stop. Do not go on. This is one of the common mistakes. They just go on because they're worried about the time, so they just like quickly stop over there. Okay, even if you miss something, I mean, if you have done this thing, okay, trust me, you will pass. At the end, you give them opportunity. Oh, doctor, what would happen to my child? Would he be in pain? Things like that. So you say, okay, well, fine, a valid question. There are different treatment options, and in case if your child is in pain, then we have got very good treatment for the pain as well, and he would be taken well care of. And majority of those kids, they do well with the pain medication and things like that. You just try to alleviate their concerns and give them factual information. And finally, at the end, you'll go through the same disclosure, safety netting, and further information about that. You say the consultant or the oncologist will have a further meeting with you and give you some more information. In the meantime, you can just like gather your thoughts. If you've got further questions, just write it on a piece of paper or something. These are the leaflets which you can go. You can spend your time with the child, and I will get back to you later on. So you go accordingly. Then moving on to the other stations, which are usually regarding treatment and management issues. This is usually a station in which there would be somebody who is under some treatment, but he is not doing well with the treatment. Probably he's not complying. Like usually it could be a diabetic child who is not doing well with his insulin medications, and his let's say the HbA1c has been very high. So you have to talk to the child, and if it's a teenager, you might have to talk to the child directly, or you might have to talk to the parents. So basically, because this usually involves either a step up, sort of step up from the current management, like either the child condition has changed, or let's say the child is not doing well with this treatment. So usually the parents are, if you're talking to the parents are usually aware that their child has not been doing well. Or if the kid is there, you just tell them that this is your HbA1c level. And usually you see, there is one thing about this thing which I want to, before I forget, that if it is regarding a teenager or something who has got like a bad HbA1c or some other thing, so usually after introducing yourself, you usually ask them, okay, how are things going with you? How are things going with your diabetes? How are you doing? Just try to know if there are any underlying circumstances which might be compelling him not to adhere to the underlying management plan. So then you say, okay, well, fine, we have done this test and this shows that your blood sugar has not been fine over the last couple of months because this has come to be very high. So just wanted to ask, like, are there any issues with your treatment plan? I mean, tell me about that. And then there will be, maybe they might say that, it's very difficult because of the peer pressures or because of their routines that they miss things. And then from there you say, okay, well, I can understand you and your situation, and obviously, but it's also very important that your sugar levels are well in control, because if it's not in control, then you can have like drop attacks, your sugar can go down, you can have hypos, or you can be unwell, or you can go into a condition which is in which the you start vomiting and your sugar levels go very high and there's a lot of acid in your blood, and you can be land in a hospital, which you don't want to. So like, try to do, or do you wish, so things like that, from you will bring them to that point where they can understand that if they don't comply with this treatment, what could go wrong with them. And then you, at the same time, you're trying to see what are the bottlenecks in their treatment, and then you try to address them. So again, if you're talking to the parents, again, you introduce yourself, but they already know about the child condition. Let's say he's been going on, let's say he's on some form of therapy, maybe an asthmatic child who's not doing well, and they already know that he's on this treatment, this, and then you say, okay, do you want to know, what do you want to know further about this thing? And then from there, you talk. So you usually, if there is a concern about a particular aspect of the illness, then you focus on that, and you would try to explain it in very simple words. Like, for example, you can ask, I can see that you've got some concerns regarding this new treatment, because child is not doing well on asthma. He needs to be started, let's say, on steroids, and say, I can understand you've got some concerns because you're not happy with him going on steroids. So can I particularly ask you, what are your fears about steroids? They say, oh, well, doctor, we have heard that it makes your immune system very weak and the bones can go weak. And I can understand, yes, you have got genuine concerns, but because we are giving it in inhaled form, the systemic absorption is very less, and what happens is that it's not absorbed in the blood. So those things are more common if they are for a prolonged period of time on oral steroid, where it goes in every nook and corner of the body, and the probability is more that they would have this. So with this, it's quite low, and majority of the kids that are put this, they do very well. And at the same time, we also keep them under the radar screen, so they are monitored very closely. There is growth monitoring and other things, and if there are any issues, we pick it up and we can treat them accordingly. So, or you can just tell them that, let's say your son has been out of the hospital, in and out of the hospital 5 times, like, again and again he's coming to the hospital with this particular conditions, and he was diagnosed, let's say, with asthma. We have been treating him with like as needed, so let's say salbutamol, and obviously you say your child has been skipping a lot of his school, and you would also appreciate the fact that it's affecting his quality of life. So you say, yeah, he's missing a lot, and he cannot play and things like that. So you say, well, this is the thing, this is what we are concerned about. So we need to start him on something which is going to make him better, which is going to give him better quality of life, and you would also agree that he needs something, and from there, like, you just try to bring them to an agreement. Okay, so it's like, once you've explained, then you check there and say, do you get this, what I told you? Okay, and then you said, okay, so do you agree that, like, he needs something better than what he's already getting, and he needs to have a better quality of life, and steroids is one of the options, and you had some concerns and have tried to address those concerns. So are you happy for me that we agree that he should be started? And then say, oh yes, doctor, you have explained it very well, and I think yes, we agree. So that's like, you say, okay, any other questions that you want to ask? And okay, well, fine, don't worry about this, we are going to start him on this thing. So if there is any problem or something, you can call us, you can call the community nurse, or you can call your GP, blah blah blah, depending on the scenario. Okay, fine. Then one session could be about like conflict resolution, which is about talking to angry parents because they're not happy about something again. So you want to introduce yourself, that my name is Dr. So-and-so, I'm one of the pediatric registrar. I'm here because I understand you've got some concerns, or you're unhappy about your child who's been admitted with us here in the hospital, And I was just wondering whether you would like to talk through this to me, so I can see how we can improve the situation and how we can address your concerns. So like, tell, okay, well, what are you particularly not happy about, or what you're angry about, or things like that. So you would ask this question, and usually because they're angry, remember, even if it's not your fault, you usually apologize. They're looking that you have to be a bit apologetic. It's not me like you are accepting the blame, but it's simply telling the parents that you understand, and that diffuses the situation a lot. So it's like, okay, well, I can understand, sorry for this thing being happening. I would like to apologize on behalf of our team that you have to wait for your child to be seen such a long time, or it took us such a long time for the results to come back. And I can understand, even if I was in your shoes, I would have been the same thing. I would have been worried, okay? And I can understand that you are so much worried because it took such a long time. But I apologize. Sometimes these things can happen. Anyhow, then you check the concerns. Okay, felt fine. Finally, we got the results, and it shows that there's nothing wrong with the child. So though you had to wait and you're not happy with that, the good news is that there's nothing wrong with the child. All the tests have come back normal, and your child is very much normal like any other child. So you talk in this way, so, and then you check whether their concerns have been addressed, because you give them why this delay or whatever they were not happy about, why it happened. And you also give that if you're not happy, please let you, this is your right. If you're I have explained it to you. If you are happy with my explanation, well and good, we will try our level best that this thing doesn't happen in future, not only with you, with other parents. But if you still are unhappy and you feel like you want to make a complaint about that, this is our patient advisory liaison service. This is their email number, this is their phone number, so, and this is their office is over there, so you can write to them, and they will further investigate this matter and will get back to you. So this way, and then you close it, that I just want to reassure you that regarding your concern, I will speak to my senior or something, or to the, let's say, the concerned colleague regarding whatever they were not happy with and how you felt about it, and we will make sure that these things, they do not happen in future. We'll try our level best. So this is how you should approach this particular station. Then once, very rarely you can get some station regarding teaching colleagues. So usually here, in, because you are talking to someone who is on the same wavelength as you, who is probably a medical professional, so here you could use a little bit of medical jargon. So you introduce yourself, hello, I'm Dr. So-and-so, I'm one of the medical pediatric registrars, and I've come here to talk to you. I understand that you have got some things to discuss with me. So okay, well, fine. So then it's okay, what do you already know about the things that you want to discuss, and what do you want to know about it, and why? So let's say, is there any particular reason you want to discuss this? Because you've seen that it's on the ward, or because you studied about it, or you don't know about it, or it's just like, picking your mind from inside, you want to know more about this condition. So fine. Or sometimes you might have seen some case in the ward. So can you tell me a bit more about the particular case you want to discuss, that child? So what led to you to raise these questions? What's like bugging your mind? So you ask what is their current understanding, and what were the background from which they are trying to raise those questions. Then you tell them what you're going to tell. So you say like, well, this is a very large topic. Okay, let's focus on, for example, it's about ethics. So ethics is a very large topic. Okay, so I know it's a bit complicated, but let's make it simple for you. So I will like focus on a few principles of ethics. For example, beneficence, non-maleficence, like justice, things like that. And then you start like talking about that. What does that mean? So as you explain each and everything, you ask for their understanding. So I've explained this to you. Do you understand this? Okay, is it clear to you? So before I move on, do you understand what I mean by this thing? And you also give them an opportunity to ask questions. And finally, okay, so today we discuss like the 4 principles of ethics, and that is based on beneficence, non-maleficence, fairness, justice, things like that. Okay, and you just read about that. If there are further questions, get back to me, and I will explain. I will be more than happy to explain it again to you. Okay, then Moving on about some of the station which can be about medical errors. Usually there are two possibilities in these things. Either the parents are aware about a medical error, like somebody who missed a medication or somebody who was given a larger dose or a smaller dose, or they are unaware. So they would be given, if you read this scenario, either the parents are aware and they are angry, or they are unaware and you have to break this news to them. So if the scenario tells you that they are aware about this situation, so usually these parents would be very angry. So you will just tackle this station on the same principles that you tackle an angry parent state. But if they're unaware, you will just deal it with just like you are giving them a new diagnosis, a new information they don't know. So again, you start with introduction, and then you ask them, what do you already know, or how is their child doing? Okay, my child is doing well. Okay, we're happy. And then if they know something, you will say that, okay, well, you are aware of this thing, that this mistake occurred, somebody gave them a higher dose, and I would like to tell you more about it, why this happened, and what we can do further to make sure that this thing doesn't happen in the future. Or if they don't know, then say, okay, well, fine, your child is doing very good, but as a doctor, as sort of principles of good medical practice, we usually engage in a very honest, open discussion with the parents. And though your child is doing very well, I just want to inform you that unfortunately there was a mistake in the administration of medication to your child, and he was given a higher dose of this medication. And then you stop, so that let the parents show their emotions or reactions. If they are angry, so I can understand, this is, you have got every right to be angry, but this happened because this is not a routine. Sometimes we are too much overworked, and this mistake occurred because of a system error, whatever, like whatever sort of a background you want to make about that based on that scenario. But you tell them that as a part of open discussion, we want to discuss it with you, and we want to make it sure that this thing does not happen in future. So I want to inform you, and at the same time I want to inform you that we usually take these things very seriously. So I have sort of raised a serious incident or a critical incident because of this error. So let me assure you that this would be looked further into. We will investigate this matter, and we will make sure that this thing does not happen in future. But the good thing is, even as a result of this mistake, I just want to reassure you that the child is fine. No harm has come to him. But obviously this is our duty to make sure that these things do not happen. So you just try to happen. And again, you'll ask, I've given you this explanation. If you are happy with this thing, well and good. If not, you've got every right to make a complaint. So this is our patient advisor liaison service, email, phone. You can make a complaint to it, and they will further raise this thing with our seniors, with the management. We'll further look into that, and we'll make sure that these things do not happen in future, because there is a culture of learning from mistakes and making sure that this doesn't. So, and then you will close that this thing happened, and I've explained it to you, and nothing has happened. If you have some question or something, you can ask me at this point in time. So this is how you would deal with a station of medical errors. And finally, you will ask if there is an opportunity, if there are concerns have been addressed and they want to raise complaints. As I told you, they can raise it with Paul's. You just give the number and things, and you just close it. And the last station could be about supervision issues. This is usually not very common, but it's becoming common in the last couple of exams. This usually involves a trainee who's a difficult trainee. Like, you have to counsel because there are concerns that either he's late or is not doing well. Again, the basic framework is the same, but it has to be slightly modified. I'm going to introduce, like, I am the senior registrar of this pediatrics department, and rather than just directly jumping over to this issue, because that can offend the other person, you usually look at how you're doing, how's life going, everything going outside of your life well, have you got any problems in something, and then say, okay, well, fine, Dr. So-and-so, the reason I'm here is because lately there have been some concerns regarding your punctuality, and people are not happy in the department that you're these days, habitually coming, or you are usually late at arriving for your duty. And I'm not accusing you, or not, and remember that you do not point at Mr. So and so has raised this is concerns have been raised, and just wanted to know so that like everything is fine, and ask you some reasons, and if there is something that we can help you in, or something we can arrange so that this issue is addressed. So you have to be neutral and do not accuse them. Say, I'm not accusing you of something, just want to know your viewpoints because the concerns have been raised, and there is just like anything that I can help with. So if you are struggling with something, so you would then in that you say, okay, well, I've got this and this, or it's becoming difficult, or I haven't done some courses. Okay, well, fine, I can understand it can be a bit difficult for somebody who is just like joined this field, and it can be a bit overwhelming with the tasks and other things. But don't worry about that. What we can do is I can arrange a few refresher courses for you, or I can recommend a few courses like where you can go attend, or can give you some teaching time, or I can arrange some teaching for you where you can go through all these things, and so that you are more sort of what you call confident in dealing with those things, and these whatever issues have been raised are addressed. So try to find a sort of a compromise, try to help them out, and the final things that should be that you both agree. There should be some form of agreement and say, yes, I agree on this. Okay, well, fine, we agree on this thing, we will arrange this thing for you. Okay, and try to be on time, and hopefully this would be a win-win situation for everyone. And you just ask, is there any questions or something? Do you want to ask something about these training things or things that I'm going to arrange for you, or there's anything else that I can help you? Okay, are you happy with that? And then this is how you would conclude the talk. So these are the few different types of communication scenarios that you can get, and how to approach them. So again, every scenario would be different, but as I told you, remember these basic principles. And for sake of practice, do some practice with your friends. Even if you do 4 or 5 like stations practice session, trust me, you will master that. So again, the basic framework is some like introduce yourself. Okay, make sure that they are comfortable in other things. Usually start with what they know about the condition, about the situation, what they already from home, and then after that you try to tell them the what you're going to tell them in the next 9 minutes. Then you go in a very simple language, using your body language, stopping in between, making sure that they ask questions, making sure you give them the factual information, and then finally if there is some form of you either come on an agreement, or you make sure they understand, make sure that they've got some opportunity to ask questions at the end, and then you summarize, close, and give them some safety netting wherever applicable. So these are the principles that you have to apply in each and every station, irrespective of that supervision, breaking bad news, whatever. Okay, so I hope you have understood something valuable from today's lecture on how to approach the communication scenarios. If you still got any questions, please put it down in the comment section below, and I will be more than happy to answer them as soon as possible. Finally, have a very good day. Stay safe, stay healthy, take care. Bye bye.